On behalf of the PHRN, welcome to today's webinar. My name's Felicity Flack and I'm the Senior Manager for Strategy and Services at the PHRN. I'm just going to quickly share my screen so we can get started. Yes, so I'm speaking to you today from the University of Western Australia, whose campus is situated on Noongar land. The Noongar people remain the spiritual and cultural custodians of their land and continue to practice their values, languages, beliefs, and knowledge. First of all, a little bit of housekeeping. If you've got any questions for today's speakers, please type them in the Q&A box at any time during the presentations. We're going to have the 3 presentations and then we'll do all of the questions at the end. So we'll try and answer as many questions as possible at the end there. We are recording this presentation and we will make it available on the PHRN YouTube channel as soon as possible after the webinar. So how we're going to run today is I'm going to do a very brief introduction and overview to Crosslink. And then we've got Lauren Davis, who's the Senior Legal Research Officer for the PHRN. Associate Professor Darshini Ayrton from the School of Public Health and Preventive Medicine at Monash University. And we've got Miriam Lamon, the head of the Integration Development Unit at the Australian Institute of Health and Welfare, who are going to talk about the different work programs that we have under Crosslink. So let's get started. So the PHRN is currently running a large program of work which we call TrialLink, which is an initiative to support clinical trials to incorporate linked data into their work. And this has 5 pillars, which you can see there on the slide. Discovery, so a lot of work around metadata. A data pillar, which is looking at a range of different types of data products, and this is where Crosslink fits in. Then access, how we improve ease of access to data, guidance, and we're developing a training course for clinical trialists. But why Crosslink? Well, when we spoke to clinical trialists, they're very interested in high quality clinical data. And obviously clinical quality registries have high quality clinical data. And in addition, we over the years have been, we've worked with a range of clinical quality registries, but also we were hearing from our data linkage units that they were being approached increasingly by the registries for enduring linkage, and that this was going to add enormous value to the registries, but it also, there was a workload burden for our linkage units. And the more we talked to the registries, there was a lot of complexity and greyness around the governance and legal framework for doing enduring linkage of the clinical quality registries. And we also weren't sure about what the community thought about enduring linkage of clinical quality registries. So we felt that there was a lot of work that we could do in this space to really improve and add value to the clinical quality registries. So that's why Crosslink. So the overall aim of Crosslink is to design a data linkage governance framework that will enable routine updating of clinical registries with administrative data, and that, of course, this needs to meet privacy, legal and ethical standards and be supported by the community. So the project essentially has 3 different work streams. The first is a governance work stream, which is looking at the legal and ethical basis for enduring linkage of CQRs. There's a consumer involvement program and there's a technical advice program that's looking at streamlining and finding more efficient ways to link CQRs on an enduring basis. These 3 streams are going to come together in a co-design process using an expert panel and consultations with a wide range of stakeholders, including the registries themselves, consumers, law and policy makers, data custodians and ethics committees, and we're going to finish up the project, hopefully, with a governance framework. So I'm going to leave it there, and I'm going to hand over to Lauren first, who's going to talk about the governance framework.
Okay, thank you very much, Felicity. I'm hoping everybody can see my screen. Before we do kick off, I will just briefly foreshadow that I've had some technical issues this morning. So if I pause for a moment, that's likely because one of my screens has just gone black. So please bear with me while I recalibrate. All right, getting into it. So as Felicity mentioned, there are 3 components to the Crosslink program, and I will be talking to you today about the governance work program component of those 3, and together they, as she said, will inform the co-design of that governance framework and the guidance materials as well. There's 3 components to the governance work program. The first is what's called a doctrinal analysis, where we do a review of relevant legislation and case law as well that impacts CQR activities, specifically in relation to their capacity to undertake routine linkage. The second component you see there is interviews stage, where we talk to industry, we talk to CQRs, hopefully, to human research ethics committees, to data custodians, to data linkage units, about how they operate in this space, what's going really well for them, what are some of the challenges that they're facing, to get a better idea of what current practices are, and what might need to change for this to be implemented efficiently. The final part of work that falls under the governance work program is what's called a desktop review. The idea from this is that we'll draw from the work done previously in the doctrinal analysis and the interviews to basically undertake an assessment of how ready CQRs are to undertake routine linkage. What are the legal and ethical issues that might be popping up and getting in the way? What are the practical and governance arrangements that are working really well that might need to be changed? And so that will sort of culminate in that last piece of work. Give a little bit more information on the 3 components. So the doctrinal analysis, as sort of just touched on there, the purpose of that is to examine and clarify the legal and ethical considerations that impact CQR's ability to access linked data and to establish those enduring linkage relationships. That piece of work is well underway. We've got a draft report with the structure that you can see up there on the screen. That's currently under review by our Governance Advisory Committee, and we're waiting for some feedback and their thoughts and comments on that. In terms of what's involved, you can see there we sort of step through introduction, methodology. In the background section there, we do a brief sort of overview of different types of CQRs, because we're aware that not everybody's uniform in terms of how they operate, what their governance structure is. We also give a brief overview of what is administrative data and how data linkage processes work. The real sort of meat of the report is in part 4, the legal and ethical frameworks. And as part of that, we've looked at privacy legislation in every jurisdiction. We've looked at select examples of public health legislation, quality assurance provisions in public health legislation that have to do with sort of ministerial declarations for quality assurance activities. We've looked at data sharing laws, human rights laws, common law and equitable duties as well, and the effect that they might have, as well as giving some sort of information on sharing mechanisms. So the different types, if you use a memorandum of understanding, data sharing agreement or contract, that sort of thing. And then the final component of that is the ethical frameworks that are relevant to linkage and to CQRs generally. There are some limitations to this work. In terms of scope, there's a huge amount of potentially relevant public health legislation, which has necessitated us basically just using sort of select or drawing from select case examples in different jurisdictions. And with privacy legislation, we have looked at every jurisdiction, but in those jurisdictions where there's both a Privacy Act and a Health Privacy Act, we've focused on just the Health Privacy Act as hopefully being sort of more relevant of the two. The other limitation that I've noted there is just imposed by the availability of public-facing information. So we are a little bit restricted in terms of the analysis that we can undertake. And the example I've given is the National Health Data Hub. We're looking at that in terms of CQR linkage to that, and are able to come up with some sort of helpful analysis, but because we don't know the full scope of sort of the creation of the agreement or some of the conditions that attach, it means it is limited in a sense. Okay, so the second component of the work, as I mentioned, is the semi-structured interviews. The purpose of those is to identify the existing practices, CQRs, with the data collection, use, disclosure of information. Are they undertaking linkage? If so, what's working well? What are the barriers and the challenges that they're coming across? And the idea of this is obviously to identify and work out what changes could be made to make this more efficient or to facilitate it where there are some roadblocks in the way. Our intended method at the moment is we plan to undertake 1-hour interviews as a starting point, generally online, potentially face-to-face, where that can be facilitated, as I mentioned, with CQRs, with data linkage units, with HRECs, and with data custodians. The idea is hopefully to draw from at least one person from each of these groups, ideally more, and interview until saturation. We'll then anonymise the transcripts and undertake thematic analysis aided by NVivo. Again, there are limitations to this project in terms of, well, practical considerations, resourcing constraints. We don't have the capacity, unfortunately, to undertake hundreds of interviews, but we are hoping that the methodology that we picked and the sort of wide variety of areas that we're interviewing from will help us sort of touch on and at least get an understanding of all of the different areas, issues and limitations in this space. Okay, and then the desktop review. As I said before, this piece of work is informed by the semi-structured interviews and the doctrinal analysis. The idea is to examine those governance arrangements in CQRs against the legal and ethical frameworks, assess their level of readiness for routine linkage, and identify potential areas for reform, not just in terms of CQR practices, but also more broadly in the landscape. We will start with a review of the CQRs that are self-reported and listed on the Safety and Quality Commission's website, and then undertake sort of initial classification of those CQRs by characteristics, or what we've termed characteristics. So these are still sort of in draft or tentative form, but we're looking at things like their jurisdictional operation, size, governance, clinical domain, approach to consent, information collection method, and also whether or not they're undertaking data linkage currently. From that, we will do a selection of case studies, which we hope are sort of representative of the main types, if we can say that, of CQRs. Then undertake that analysis of the governance practices and come up with our conclusions about readiness for linkage. Again, limitations. We're conscious that the categorization is a little bit artificial, but we still think it's necessary in order for this work to have the most broad utility possible and be of use to the most amount of CQRs possible. And obviously, the other limitation is those that flow through from previous work. So where we've had limitations in terms of scope of the doctrinal analysis, those will flow on to the desktop review. The report generated from the desktop review will be used for the expert panel and co-design process, and the design of the governance framework and supporting materials, which, as Felicity has mentioned, the idea of that's to facilitate linkage with administrative data whilst meeting those legal and ethical requirements with confidence. Thank you. All right.
Thanks, Lauren. So I might just remind everybody that if you've got any questions, can you please put them in the Q&A box, and we're going to get to questions when all of the speakers have given their presentations. So next, we're going to move on to Darshini, who's going to talk to us about the consumer involvement program.
Come off mute. Hello, everyone. I'm really thankful to be able to chat to you about the Consumer and Community Involvement Program under the Crosslink project. But I thought, well, before I start, I just want to take a moment to recognise for Monash University that its Australian campuses are located on the unceded lands of the people of the Kulin Nation. So I'm zooming in from Wurundjeri land, and pays its respects to their elders past and present and any First Nations people here with us today. In terms of consumer and community involvement, I thought it would be good to just give a little bit of an overview for those of you who may not be familiar with this terminology or this process or the why. Starting with a quote from Tricia Greenhalgh, who has borrowed a little bit from Jane Austen. It is a truth universally acknowledged by policymakers, researchers and research public funding bodies that patients and the public, who we call consumers and community involvement, should be involved in research, though there are different perspectives on what such involvement should look like. And so really important for this project is to understand the why. There is so much that is happening and going on, and as we've heard from Lauren, there's a lot of legal and ethical elements to be taken into place and consideration. And so why? Human rights. Everyone has the right to participate in decisions which may affect their human rights. So participation may be active, free and meaningful, and give attention to issues of accessibility, including access to information in a form and a language that can be understood. So do people understand what data linkage from registries to administrative data, for example, involves, looks like, means for their human rights? A rights-based approach to health, again, is about meaningful participation, ensuring that national stakeholders, including non-state actors such as non-governmental organisations, are meaningfully involved in all phases of programming, assessment, analysis, planning, implementation, monitoring and evaluation. And so again, this is a key piece where we can see consumers involved throughout different processes. If we bring it back to a local level in terms of thinking about health services, there are national standards, and Standard 2, which is around partnering with patients in their own care, which is really about that shared decision making. But the bottom point around partnering with consumers in organisational design and governance really is around thinking about, well, do people understand what data is being collected around health services, routine data administration, any of those types of elements as well. And then from a research lens, we do know that the NHMRC and MRFF require consumer and community involvement in grant applications and funded projects. And this is just a snapshot from the Medical Research Future Fund in terms of their principles for consumer and community involvement. And you can have a look at what that all covers. But I do want to just draw attention to broad diversity and equity. And I think it's really important to take that into consideration in light of the broad diversity of registries that will be involved. In terms of quickly looking at the research, there are quite a few papers that have been studied and published around patient and public involvement in terms of data linkage. And I've just put a few up there in case you want to have a Google. But some key takeaways from this is that patient and public involvement, or consumer and community involvement, can really improve legitimacy of data linkage practices and governance systems. It can inform research questions for linked data. So for all of those people who are interested in using registries for trials, it really can provide, consumer involvement can provide an opportunity to say, these are important research questions from our perspective to be asked. But understanding the process of data linkage also improves transparency and also trust. There are limited studies on registry linked data, and so this really does highlight the need for this project in terms of meaningful consumer engagement and really promoting that two-way knowledge of what is meant by data linkage in this context. So this package of work has two objectives. So to understand consumer attitudes towards routine data linkage involving clinical registries, and to inform and review the design of the governance framework that is created and co-designed by that expert panel. We have two main phases, and so in phase one, which we are about to kick off, so get your phones ready because there will be a QR code for those of you who may be interested in participating in this. We're going to have 7 focus groups and also any interviews, if that is preference, with consumers and carers with and without data linkage experience, maybe on registries, general community members, to understand a little bit more about what they think about this process. So in those focus groups and those interviews, there'll be a little mini presentation on registries and data linkage, because we cannot take it for granted. I don't even, I learned a lot from just listening to Lauren. So, I think there's a lot that we want to make sure we're not assuming in terms of knowledge. And then we're going to talk about privacy and trust of data linkage processes, transparency and governance expectations, and consent and data security preferences. We'll then do some analysis, and all of that information is then going to inform workshop 1 of phase 2. And so this is where we will have the same consumers or community members from the focus groups and interviews, with addition of registry stakeholders and governance experts. And in workshop 1, we'll present those findings and say, this is what we heard from all of those focus groups and interviews. We're going to brainstorm some practical resources and key messages to strengthen consumer confidence in data linkage. And then those outputs are going to be shared with the expert panel, who will then meet and do their work between workshop 1 and workshop 2. And in workshop 2, we'll bring together the same participant groups, and we will review the expert panel's governance framework elements, and we will ask for our consumers and our participants to provide feedback and clarity on its clarity and its relevance. And to really help us identify any areas that might need refinement, and again, further brainstorming of resources and information for consumers and community that will help understanding in this area. We are also actively recruiting for consumer advisory committee members, and so that QR code will also have a little tick box around whether or not people are also interested in being part of the committee. What we are going to be asking of the committee is to review the results of the focus groups and the interviews and help with the planning of the workshops in phase 2. The committee will then also review the results of workshop 1 before we do workshop 2, and also the final outputs that come from both of those workshops. So as I said, we are seeking expressions of interest for those focus groups and those interviews, and you can also let us know if you're interested in being a member of our Consumer Advisory Committee. So thank you.
Thanks, Darsh. So just another reminder, if anybody's got any questions, please go ahead and pop them in the Q&A box, and we'll get to questions after Miriam's talk. So next over to Miriam, who's going to talk about the technical work package. Thanks, Miriam.
Thanks, Felicity. I'm just trying to share my screen correctly. There we go. It should appear any second now. All right.
Good.
Got it? Fantastic. Thank you again, everybody, for allowing the opportunity to participate in this workshop. Today I'm going to be talking about the technical advice stream of the Crosslink project. And just to note that I'm zooming in today from Ngunnawal country in a beautiful day in Canberra. This is the final sort of stream of work. And it's sort of exciting to be finally sort of investing resources and focus on linkage for clinical quality registers. So the technical advice stream is being co-led by the Australian Institute of Health and Welfare and also the New South Wales Ministry of Health, specifically the Centre for Health Record Linkage. And this stream will involve consultations between clinical quality registers and data linkage units. These consultations and engagement will aim to inform the design of a shared data flow diagram or maps that we're hoping to support, will help to support efficient and scalable linkage across multiple registries and across multiple data linkage units. The technical stream will also provide advice to support the consumer and governance work program. So we're planning to sort of have that open dialogue between the three streams of work. And as part of this, we also want to analyse different options for achieving a practical technical linkage model that is cost efficient, resource efficient and scalable. So I just wanted to acknowledge also that the PRHN and the current linkage landscape is already diverse and extremely productive. So it's a national network, as you know, of linkage units, secure data laboratory and e-research services that already support health researchers' access to linked population health data. And that linked data helps us understand how individuals access services and behaviours beyond the central direct contact point that they might have with the clinical quality register. And this view supports the development of more, effective and holistic models of care. And as clinical quality registers mature in their digital infrastructure and their data systems, but also data custodianship, many are now turning to linkage as a key element for furthering quality assurance activities. And so, as a great example, we've got many people who, clinical quality registers who already undertake annual linkage, for instance, to the National Death Index to be able to identify deceased registrants as a quality assurance activity to remove those from their list of registrants. And that's a fairly common activity that's underway across most of these data linkage units. But what is the problem? And many of these things on this slide are actually generic to the whole data linkage landscape rather than specifically technical issues for clinical quality registers. But I thought I'd make sure that I was comprehensive enough. And as Lauren sort of outlined, the first challenge is really relating to the absence of a federated data sharing model where data sharing is fragmented with many one-off and ad hoc linkages. And there are differences in the legal basis, the governance models and data sharing approaches across registries and across data assets. The second challenge, which is everyone's favourite, is cost. While it's not technical, efficiency drives a lowering in the resources required. And so this bespoke situation that has been the case up to recently means that custom solutions sort of drive up those costs for clinical quality registers to participate in linkage. The third challenge is around data duplication and that limitation around collaboration. So we end up with a lot of redundant data set, redundant data sets being sort of created. So that increases the burden of ethics processes, storage, and it just increases our risk. There's also the limited ability to just really share code and protocols and build on each other's work. So you don't have that efficiency built in there. And then the fourth challenge, which is more on the technical side, which is variation in the linkage methodology and infrastructure being used. So we might have inconsistent tools and methods being applied, and that can lead to duplicated effort and inconsistent analytics. And the difference in identifiers being used to actually achieve linkage matches can also reduce linkage accuracy and add complexity to the process. So in the technical advice stream, we are planning an upcoming survey as one of our first activities of clinical quality registers. And so the purpose of the survey is to better understand the governance arrangements, the technical readiness and linkage capability across different clinical quality registers. The survey will focus on the availability of person identifiers and the quality of the data and the system setup and whether it would support repeat linkages. So this includes assessing whether a registry, collects key identifiers, and I've put a couple of those on this slide just so you understand what I'm talking about when I refer to person identifiers. This information we're hoping to have the survey out in the next month or two. So watch your inboxes. And we're hoping the information will help us identify opportunities to further strengthen the linkage infrastructure and inform advice we can apply to the governance stream around consistency of the actual collection of the variables across registries. Now, just to give you an idea, the survey is also planning to then feed into some further work we will do on mapping the data flows. So I'm not going to explain this slide. It's just to give you some visual impact, really, to explain how we're planning to use the information from the survey, and then to take that to work with the various state and territory data linkage units, and also the national or Commonwealth data linkage agencies like the HW, to further refine and develop what efficient data flows might look like, and also, I suppose, advice that we could propose to enable a more efficient process for sharing and linkage. And it would be remiss of me to not mention some of the work happening at the Commonwealth level on addressing some of those technical challenges that I mentioned in the slide further back. And within the HW, we have already started work, I suppose, on developing the identified national linkage system that can support the health research community and can also be used by clinical quality registers to build in some of those efficiencies. So I'm sure most of you have already heard a lot about the National Health Data Hub already, so I'm not planning to go into the ins and outs of it. This slide just shows you some of the current content available in the core of the National Health Data Hub. It spans across a wide range of health and welfare, increasingly welfare data sets, many of which are sourced from the state and territories. Now, Lauren mentioned just a little bit about needing to build in some of the governance into the doctrinal analysis, and we're really hoping to partner through this Crosslink project to help inform that further. I was going to point out that there is currently one clinical quality register linked into the National Health Data Hub in an enduring way, which is the Australian and New Zealand Intensive Care Society data collection, but we have about 14 or more clinical quality registers already working towards undertaking enduring linkage with the National Health Data Hub. And also just that work, I suppose, on the National Health Data Hub is trying to address some of those key challenges, the benefits including sort of data access and coverage, reducing inefficiencies, providing a flexible and responsive system that's adaptable to emerging issues, that's scalable over time, and allowing for that gradual expansion of content, which is exciting. And finally, also on a technical angle, the Hub is working specifically to support interoperability across the national linkage landscape and between the jurisdictional linkage units and nodes to enable two-way data flow. And so we're working on initiatives like the National Master Linkage Key project. So obviously the National Health Data Hub is just one of many national government-funded enduring assets under development, and would be remiss of me not to acknowledge those. But it's important for us to then, I suppose, consider some of the outcomes from this Crosslink project and see how the outcomes from the project can then also be incorporated into the future plans and applied in the development of the future development of these national assets too. So we're really excited about partnering as an outcome from this project. Thank you.
Thanks, Miriam. So thank you to all of our speakers. I think that's been a fabulous overview of our plans for Crosslink. We do have a few questions in the Q&A box, but we've got plenty of time for questions. So if people have other questions, please add them to the Q&A box and we'll try and answer as many as we can. So I'm going to start with a question for Lauren, which is, will the doctrinal analysis be published or made publicly available?
That's a great question. The answer is, at the moment, we're not sure exactly what we intend to do with that document. Obviously, it's to inform the eventual development and the co-design phase of the governance framework, but whether it will be sort of publicly available, more broadly circulated amongst stakeholders, is a TBA. There's certainly some very useful information in it that we would like to be able to disseminate. It's just the form that takes is something that we have to consider. It's a very long, lengthy, detailed document that I suspect will not be something that many people want to take the time to delve into in its entirety. But if we can provide some key takeaways from it in an accessible and a usable form, well, certainly that's something that we'll be looking at.
Yes, thanks. And one for Miriam. If ANZICS is already in the NHDH as an enduring data set, can others request access to linked ANZICS data?
Yes. So the current extract is based on a data sharing agreement with ANZICS. They've worked through the governance and the rules attached to that. It is currently available. So if I'll pop in the chat the link to the National Health Data Hub access resources. And so there is, when you work through like a project application, you can specify and apply to access that ANZICS data within the National Health Data Hub, and it will be considered within the remit of your project, and obviously is subject to the standard ethics approvals. So the answer is yes.
And Darsh, can you tell us a bit more about how you're going to recruit participants for focus groups and how you're going to make sure you've got an appropriate spread of registries represented?
Thanks, Felicity. So I think that we're going to take a few different approaches to recruitment, hence also the expression of interest. So can I put that in the, can I pop a link somewhere? No, that's all right. Anyway, the expression of interest will then help us go through and we'll ask kind of questions on who people are and what kind of hats they'd be bringing into that focus group. And we will also do a bit of snowballing and purposive sampling through registries as well. And we're wanting to make sure we have representation across different registry types, different states, different characteristics that we're looking at. And so, yes, we've said 7 focus groups and some interviews, but, if we need to do a few more just to make sure we capture great diversity, then we will be doing that. So hopefully that answers your question.
Back to Lauren. How are you going to select participants for your semi-structured interviews?
That's another good question. So as we mentioned, we want to talk to people from sort of those 4 key areas: current CQRs, data custodians, HRECs, and data linkage units. There's obviously a finite amount of data linkage units in Australia, and in terms of HRECs as well, there's some sort of scattered throughout all of the different jurisdictions, which makes the selection process sort of a little bit more restricted. In terms of identifying CQRs for participation, that is something that we still sort of need to look at, but I think we'll be trying to sort of draw from CQRs with diverse experiences and sort of talk to a range of different CQRs, whether or not they operate sort of as an opt-out consent model, or those that are sort of subject to a declared sort of a ministerial declaration, or use a different sort of consent model, that sort of thing. In terms of identifying those, as we said, that's a bit of an open question. We will be sending out invitation forms to people that we've identified that we hope will be interested in participating, and then see, I guess, what response rate we get, and then maybe go from there in terms of who else we might need to talk to.
It's probably worth pointing out that we have a list of what is it, Lauren, over 140 odd CQRs. So yes, we'll be working off that list.
Yeah.
But related to that, there's also a question here that says, can individuals or teams from CQRs interested in being involved in the interview process express their interest somehow? And I think the answer to that would be yes, we'd love to hear from you.
Absolutely.
And if you just use the generic PHRN email address, you can get to us, no problem. Dash, we've got some more questions for you. Can you talk about what type of people should request to join the Consumer Advisory Committee?
So we're really interested in, again, diversity, and we would like people who might be on a registry, know they're on a registry, caregivers or family members of people who are on a registry, but we would also love to have people who are general community members who might not be on a registry, because it is important to understand what would you want to know in the event you might be invited to be on a registry in the future. And so a bit of a mix across those three, I guess, types of people.
Thank you. And Miriam, back to ANZICS, does the NHDH, in the NHDH, does ANZICS have control over who access their registry's data, or control over review of analysis prior to publication?
Yes, the answer is yes to both of those things. So the terms of the data sharing agreement includes the preferences of the registry, and where ANZICS has a pre-existing data release and access policy. Yeah, all project proposals are reviewed and approved through the registry, as well as the outputs for publication. So yes.
And one more question, which actually I think is really for you, Miriam, but Dash might have an opinion. Is there any consideration given to include consumers in data request approval processes for the NHDH linked data, in addition to custodian approval?
Maybe I'll answer the question and I'll hand over to Dash, because I think it's, I'd love to hear her response as well. So at the moment, when a project, when you are seeking just to access the pre-linked data, not necessarily adding a new data set in, all project proposals have to explain how they're incorporating in a consumer voice in their either design or in the proposed outputs. So it's part of the project proposal application process. But it's also considered, I suppose, in terms of joining new data into the National Health Data Hub, in terms of you going through a full ethics process and vetting that. So having to work through how, whether you're including any data from any vulnerable population according to a normal HREC process. But so yeah, it's something that it'd be really good to see the outcomes from the CrossLink project to make recommendations to how we can make that process better, or firm that up, or how that might be modified. So over to Dash on her opinion.
I mean, I think that what you outlined is amazing, because I do think, if they're putting through a proposal and they've said we've spoken to consumers, or we have people who've suggested this is like the type of analysis we think would be a benefit, or whatever that might be, that's really amazing. And I do think we're going to learn a lot from this project in terms of, okay, people might tell us through the course of this that they do want to have a panel of consumers that maybe has a bit of input into data linkage requests. I'm not sure. That's why we're going in with an open mind and seeing what might come out. But I think there's lots of different models that can be undertaken. And again, it might depend on who's available, how do we support people, or there's a lot of questions, because the diversity on that NHDH group is a lot, probably. And so there might be a few different models to make sure consumer voices are heard.
Okay. Well, I think we've answered quite a lot of questions now, and I'm sure people would like a few extra minutes in their day. So I think we'll wrap up here, and I want to say thank you so much to Lauren, Darsh and Miriam for their presentations. And we've been so excited to share the Crosslink project with you all. And we hope that we'll be back again sometime probably early next year, maybe to tell you how far we've got and what's going on in Crosslink. And we encourage everybody to get involved. There's lots of ways that you can get involved in Crosslink, and we're keen to have the points of view of as many people as possible incorporated. So thank you very much to everybody, and we'll see you next time.